Hello all, my name's Kelly Nicole McConkie. This is my presentation for Assignment 4 in Evidence-Based Practice in Nursing with instructor Kim Bergeron at Athabasca University. Throughout this course, I studied a topic using a PICO question, which originally was developed to discover the effects of IV fluid rates and rehydration and how it contributed to cerebral edema in pediatric diabetic ketoacidosis, or DKA. For those of you who are unaware, cerebral edema is basically swelling of the brain in presence of excess fluid. DKA is a diabetic emergency in type 1 diabetics where blood glucose is severely high and there is an excess of acids or ketones in the blood and or urine. After a thorough research review, it was found that there was no evidence to support that IV fluids alone contributed to cerebral edema in DKA, but it was more of a multifactorial event that cerebral edema may already be present upon initial hospital presentation. For this reason, I had to adjust my PICO question when creating an intervention. The intervention I created was an awareness and education campaign, which ultimately would be directed towards children as a target population. However, due to their cognitive independence level, the intervention I chose, being awareness and education, would actually be community-wide. As most of you are aware, diabetes, both type 1 and type 2, are on the rise worldwide. Because of this, there are many already in place programs and interventions aimed at decreasing rates of diabetes, management of diabetes, and increasing resources available. My intervention and poster created attempted to educate the entire community with a similar focus. The picture on the right-hand side of my poster, which is available to you guys to view, is the common signs and symptoms of DKA and the importance of seeking medical attention if these signs and symptoms are present. The picture was an actual poster that was created as an awareness campaign and study in Australia, and it was successful in decreasing DKA episodes by 64%. The poster has now been distributed to 24 countries worldwide in various languages. I found that this, having been proven to be successful, was an important component of my poster. The use of different languages and the use of text along with picture was noted important when looking at considerations and barriers for this topic and intervention, as the target population is ultimately pediatrics. The other core features of this intervention to reduce incidence of DKA was the importance of healthy lifestyle, which includes healthy eating and exercise, and finally glucose monitoring, which is needed in type 1 diabetics as they are insulin dependent, all of which cause fluctuations of blood glucose, and improper management can increase DKA risks. Within this poster, I tried to incorporate the main points of DKA to help awareness and education to the community by using evidence-based facts and strategies in a fairly simple to read and straightforward manner. And I also tried to make it non-intimidating. My intervention goal was also to provide resources to practitioners, schools, and parents to act as a resource guide. Ultimately, the goal is to reduce the incidence of DKA in type 1 diabetics. I hope that this presentation was informative, and please feel free to ask questions, as this was a short presentation. Many programs are already in place, which I found, and that certain aspects of targeting a specialized population, such as pediatrics and multiculturalism, can be challenging. Suggestions and considerations were found. Thanks for your time.